Hi, I'm Dr. Cynthia Gregg, and welcome to our Fall Patient Appreciation Day. We're really glad you could join us, and we thought today we would spend a little bit more time explaining the importance of our patient care coordinator and how she works with both myself and Dr. Wu to make your rejuvenation journey exactly what you'd like to achieve.
Hi, my name is Ellen Ortiz, and I am so glad to be a part of this team at Cynthia Gregg, MD Face and Body Specialist. Just want to tell you a little bit about myself. I have been in plastic surgery for over 20 years, not only as a surgical coordinator, but I am also a certified medical assistant. So I have more knowledge as far as what happens in surgery, the do's and don'ts. I have been in with the surgeons, with the PAs, with the estheticians. I have assisted in surgery. I also do pre and post care. So I have a lot of knowledge when it comes to what it is that our patients are looking for.
And that's so important because when you call our office, and there's multiple ways you can reach us. You can go to our website and send us an email. You can also click on Book a Consultation button on our website. You can also call us directly. If you call our office and you're new to our practice and you say, I'm interested in some type of facial or body rejuvenation, you're going to speak with Alma. And that's really important because Alma needs to make sure that you're on the right path to talk with either us or one of our non-surgical providers.
So there's a series of questions that I'll ask you, whether I get it through an email or we talk on the phone. And it's not that I am prying, I am just trying to get the right information to make sure that we are getting you on the right journey, whether it's surgical, non-surgical, or both, because it could be. We are a multidisciplinary type practice, so we like to make sure that if you're going to have facial surgery with Dr. Gregg, that your skin is in optimal condition so that after surgery, you will have the best possible result. And sometimes we'll need to have you see one of our estheticians to help you do that. And with regards to Dr. Wu, there are just certain things we have to make sure medications are checked, that height and weight are important, any major medical issues that patients have. Those are all things that will affect either surgical or non-surgical procedures.
Right. And I think that's so important from a medical perspective because all of the information that Alma gathers from you, I'm going to look at and review before I even see you. So it gives me an idea of what we should talk about, which direction we need to go. But for instance, she was talking about the importance of skin care. There's a facial procedure called laser resurfacing, and that is an integral part. And if I know you're already on particular products like vitamin C's and Retin-A, then we don't have to spend time pre-treating you because we know you're already on it. It's also very important for us to know any previous surgical procedures that you've had, face and body, and also I need to know from a facial perspective if you've got any Botox or filler in place, because I need to understand if I'm seeing a clean canvas or if I'm seeing a face that's already got some, rejuvenation in it. It's going to help me decide what we should or should not do. Regarding your medical history, you talked about the importance of getting height and weight and medications and such. For instance, facelift surgery. I cannot really operate on anyone who uses any type of nicotine, whether that be vaping or smoking or a patch or a gum. And so we need you to be honest and let us know these things because maybe we could get you on some other options, non-surgical options, while you're coming off the nicotine if you are a nicotine user, so that we can do your surgery safely. I think it's important for people to understand that even though we're not doing these surgeries in a hospital setting and you're choosing to have it done, it's an elective procedure, we take it very seriously. And we have a procedural suite that's accredited by a national organization, and we use licensed anesthetists, nurse anesthetists that are excellent and they give great care. And so our job is to make sure that you understand before and after teaching, and we do everything we can to keep you safe. And understanding your past medical history is part of that puzzle. So other than you talking to them on the phone when you book the appointment, you then send them some forms, right, to get this information?
Yes, so we send you, the online medical history is the most important thing that the doctors need to see, and we like to have that in within 2 weeks of your consultation. Now, sometimes your consultation may be a month out or a little bit longer, but we do ask that you get onto the portal and at least get those forms done. If they're in your chart and they've sitting there for 3 weeks, 4 weeks, that's wonderful because the doctors will have optimal time to be able to review it so that when you come in, your time spent with them is well spent.
Right.
They'll have all the information that they need, and then we will be able to give you the best possible results.
Absolutely. And so our goal again is to keep you safe, to give you a natural look. and to offer both surgical and non-surgical rejuvenation options, because we do offer all of that here. And so Alma is really the person that's going to help direct that, and then we're going to make sure that you have a wonderful result.
Absolutely. That is our goal, is to give you the best possible result in the safest way possible.
Absolutely. So we look forward to meeting you. If you have any questions about this video, you can send us an email at surgicalquestions@cynthiagregmd.com. Thank you so much.
Thank you.